Good evening, everybody. Welcome to Dil Se Dil Tak. We are live from the city of Bangalore today. We'd like to introduce someone who is an eminent personality, an eminent cardiologist of Bangalore. He's the professor and head of department of cardiology at St. John's Medical College and Hospital. His name is Dr. Kiron Varghese. So first, we'd like to see a video on him, his message, what he does regularly, and then we'll definitely go and meet him. Let's see the video.
What started as a dream of becoming an engineer for a young boy changed into a reality of being an eminent and outstanding gold medalist doctor today. He's a renowned cardiologist known for his ethics when it comes to treatments of his patients. Meet Dr. Kiron Varghese, whose mantra in life is to be happy and healthy. He personally feels that if you want to be fit, then eat less and exercise daily. He practices what he preaches, and on weekends he do cycling for approximately 50 to 60 kilometers. Apart from his daily routine of walking, cycling and a special initiative to be near nature by working on his rooftop garden. The highlight of his routine is that he prefers to walk wherever he goes during the day to be fit. Dr. Kiron believes in spreading happiness in people around him and society at large. His relentless and untiring service to humanity by serving poor, needy and old patients is acknowledged globally. He had organized free angioplasty camp during January and February 2019 for economically underprivileged patients. He even did free cardiac intervention along with free 5 stent for a poor homeless person living in his vicinity. Recently, Dr. Kiron set another remarkable feat by doing an angioplasty on the oldest man, Mr. Muniappa, the news of which was published in all major newspapers, including Times of India. Dr. Kiron is working as professor and head of cardiology at St. John's Medical College Hospital since 2013. He did his MBBS from St. John's Medical College, Bangalore in 1982, followed by MD in General Medicine from Bangalore Medical College and Research Institute in 1987. He further went on to do his DM in cardiology from Sri Jayadeva Institute, Bangalore, where his dedication and hard work made him excel in all his exams, and he secured first rank during his DM exams in 1992. In his endeavor of upgrading his skills, Dr. Kiron did specialized trainings in the field of cardiology from globally renowned institutes such as Fellowship in Interventional Cardiology from Sinai Medical Center, Los Angeles, USA. He is also fellow of many reputed national and international associations. To name a few are, he is fellow of the American College of Cardiology, FACC, fellow of the Indian College of Cardiology, FICC, fellow of the Cardiological Society of India, FCSI. He is also life member of Association of Physicians of India. Dr. Kiron Varghese, in his medical career, has a distinction of working with some of the leading hospitals of India and world. Post his DM, he started as Senior Registrar Cardiology at Malya Hospital, Bangalore from 1992 to 1994, followed by working as Consultant Cardiologist in Chest Diseases Hospital, Kuwait from 1994 to 2000. Then he joined as Interventional Fellow at the Sinai Medical Center, Los Angeles from 2000 to 2001, and since 2002, he is associated with St. John's Medical College, Bangalore. Dr. Kiron's area of expertise includes interventional cardiology, peripheral interventions, and preventive cardiology. Dr. Kiron has deep interest in research and has worked as primary or sub-investigator in numerous national and international trials. He has over 30 full paper publications and over 60 abstracts published in reputed journals across the world. To name a few are, use of coronary hardware in peripheral vascular interventions, necessity fostered ingenuity, is it solution enough? In Indian Journal of Heart 2018. Dr. Kiron has also written a chapter in a book and authored a book titled Therapeutic Embolization. Apart from being a busy cardiologist and a rhythm specialist, Dr. Kiron loves to find time for his love for music, singing and playing guitar.
And the only explanation I can find is the love that I found ever since you've been around.
Let's listen to a healthy heart message from Dr. Kiron Varghese.
Good morning, sir.
Very good morning to you.
Any message for the patients, because heart disease is the #1 killer in the world? although there is rising awareness, but still the rate of death is very high with heart diseases, and it is very sudden also.
Right. So, India is probably among the highest rates of heart disease in the world. It may not be much of a surprise if I tell you that the maximum number of obese patients are in America, but India is at number 3 in that position. Yes, and I think that is partly contributing to our increased heart disease, and it's because we eat the wrong type of food, we eat too much of that food, and we exercise too little. So whenever I tell my patients, you need to lose weight, they'll say, yes doctor, I'll start walking from tomorrow. But the key to losing weight is to eat less. The amount of calories in food is something which we don't realize, and the calories we burn while, say, walking is very small. You burn roughly 4 calories in a minute. One milkshake is 400 calories. One masala dosa varies from 250 to 1000 calories. So with one milkshake, that means you need to walk 100 minutes. So people walk for 30 minutes and come and have a milkshake. That just doesn't make sense. So anyone who wants to lose weight, it's all about eating less.
And eating healthy also?
Eating healthy is probably second, because once you lose weight, automatically your blood sugar, your blood pressure and your cholesterol will improve. So losing weight is of fundamental importance. What people do is they stop eating rice and eat chapati, the same caloric amount. It doesn't help. You need to reduce the amount of food that you eat. If you eat one peanut, you need to walk 2 minutes to burn the calories. So unless you're a manual worker, you just cannot burn the amount of calories that are required. So if you're serious about losing weight, you need to eat less, but you need to balance that with exercise, because otherwise the body goes into what is called the famine mode and reduces your metabolic rate, and you don't lose weight because the amount of calories that you burn at a resting state also will come down. So to keep your metabolism up, you need to balance it with adequate exercise. But exercise is not the key to losing weight.
Butterfly, my butterfly, I'll come home.
Welcome, Dr. Varghese. I think one of the message from the video was that the secret to a healthy heart is the playing your guitar. I mean, probably you can start a band one day.
Thank you. There's no time for that. They say medicine is a very demanding mistress.
Yes. Yeah, so today we have a very pertinent question, important question for you. Frequently we have seen that when there is a heart attack in an individual, that person mistakes it for just a gastric problem or a acid or something, and then they take all those medications like Eno and home remedies, and then they lose the important time which they might be suffering from a heart attack. So how do the patients differentiate between whether they are having a heart attack or a gastric pain?
So this is not an easy question to answer. Even experienced cardiologists can sometimes find it difficult to decide whether it's a heart attack or not, and sometimes need ECG and many investigations to really make a final diagnosis. But there are several points which can be of help to a layperson to decide whether this is something which needs attention or not. So I'd like to say what are the characteristics which make you suspicious that it could be a heart problem, and what are the points which point against it. So the heart is an internal organ, and the body handles pain in internal organs a little differently from the surface of the heart. For example, if a mosquito stings you, you know exactly where the pain is and where you can localize the pain. But for internal organs, the brain refers the pain to the surface of the body, and it's not very accurate. It's generally over a larger area and could be very variable. So as far as cardiac pain is concerned, it can be anywhere from the lower jaw up to the umbilicus. So it's a large area. Typically it's in the center of the chest or to the left side, left arm, that's what most people know. But it can also be on the right side, right shoulder, right arm, back, as I said, neck, and up to the umbilicus. Then the character of the pain, most people expect a very severe pain, which it could be. but sometimes it's just a burning sensation. So understandably, if you have a burning sensation in the upper part of the stomach, everyone will assume it is gastritis or gastric problem. In truth, there are so many other conditions which can also mimic cardiacs, not just gastritis. So it can be a burning sensation, it can be a heaviness. Very often it's just a weight on the chest or a constricting feeling in the chest, which may or may not radiate down one arm or the other. The duration is also important. Any pain that lasts less than 30 seconds is not cardiac. Any pain that lasts more than 6 hours is unlikely to be a heart attack, but very often, because it's not the full-blown attack, it can be a stuttering attack, it can last much longer than that, 12 hours, sometimes longer. But if it's been happening repeatedly, like the patient says that I've had this pain, this kind of pain lasting 6-7 hours, I've had it last week and last year and like 2-3 times a month, obviously each of those couldn't be a heart attack, right? So if it's been multiple similar episodes in the past, one would kind of ignore that. Now, there are a few points which point away from being a heart attack. Like I said, since the heart is an internal organ, you cannot make the pain worse by, say, pressing on the area. So if there is pain, now if a patient comes to me and says, Doc, I got pain here, and points with 1 or 2 fingers, straight away in my mind I'm thinking that this patient doesn't have a heart problem. Because as I said, it's a referred pain, it's generally over a large area. They come with a hand on the chest, or it's a more diffuse area. If you press the area of pain and it gets worse, it's likely to be local. If it gets worse with movement of the arm or the neck or the shoulder, again, it's more likely to be musculoskeletal. So these are some points which can help you decide whether you need to take it seriously or not. In short, any kind of discomfort which needn't be pain, heaviness, burning from the jaw to this, associated with sweating, which is a very important associated symptom, should be taken seriously. Similarly, if it's associated with breathlessness or lightheadedness, these are symptoms which should prompt medical attention. And if it is a heart attack, then 50% of the deaths due to a heart attack occur in the first 1 hour. So that's the golden hour, we say. So it's important to get to a hospital with good medical facilities as quickly as possible if you think it's going to be a heart attack. A lot of the delay is because the patient thinks it is something else, then doesn't want to wake up his wife, doesn't want to bother the neighbor, but then after an hour or two, he eventually does it. So if you think it is likely to be a heart attack, then get to a hospital quickly. The background of the individual also plays a huge role. Now, if a young lady, you say a 20, 30-year-old lady, who doesn't have major risk factors, has fairly typical symptoms, it's very unlikely to be a heart attack. Because the chance of a young woman who doesn't have risk factors, non-diabetic, having a heart attack actually is quite low. Because age is the strongest risk factor, and conversely, young age is the greatest protector also. We don't see this in male smokers. A lot of our young male heart attack patients are smokers. They come in their 20s and 30s with heart attack. So if you have multiple risk factors, even somewhat atypical symptoms probably warrant attention. And if you're young and without risk factors, probably we also don't go aggressively after such patients if we think that they don't have much risk factors. Of course, we are only talking of statistical probability of a heart attack, and only tests will tell us further. The key is probably keeping all the risk factors under control, as was mentioned by the earlier speaker, and regular checks. So if you're a diabetic, and you should probably go for a regular checkup, and your cardiologist will assess that and tell you what the probabilities of a heart problem is, and if that is the case, how to take preventive measures.
Okay, good. Thank you very much, Dr. Varghese. Thanks for your inputs. We got a fairly clear idea now how to differentiate. I think definitely the audience will take note of that. So we'll come back to you in the panel to have more insights on this. Thank you.
Thank you.
Dr.